everyone. Welcome back to another episode of the Sci Huddle. It's been a long time since my last episode. So I've been looking forward to this recording for quite a bit. If you are new to the Sci Huddle, hi, my name is Farah and I am going into my fourth year of nursing school at the University of Alberta. And I started this podcast a few months ago as part of the Health Sciences Student Association, just to feature some very cool health sciences students that do very cool community work and community engagement and have very cool passions, and talk about what led them into health sciences and their journeys and their community work and what their vision looks like for the future of healthcare. Because I know personally, I really like sharing what I'm passionate about. And originally I thought the things I'm very passionate about didn't link to each other very well until I started sharing some of the aspects that I care about. And then I realized that a lot of more people than I thought cared about the same things. And then it was very empowering, and it led to a lot of very cool community work that I've started over the past few years. So anyways, today I'm here with Rayyah Sempala. Rayyah is a very cool health sciences student. She's also my co-president in the Health Sciences Student Association, so we work a lot together. And that's partly why I'm excited for this episode, but also because, Rayyah, you have a very cool background that led you into the program that you're studying now. I'll let you talk a little bit about yourself and your journey and what led you here.
Yeah, so hi everyone. My name is Rayyah Sempala. My other name is Namakula, decolonization, but we'll talk more about that. So I have an undergrad in sociology with a minor in French and human resources from MacEwan University. So currently my program, I'm a master's student in the School of Public Health. It's a Master's of Community Engagement, so it's related to like the MPH and then I think also the MSc program, but they're under the same School of Public Health umbrella. Mm-hmm. So how I came to apply for that, during high school I volunteered a lot. I started the debate club at my high school, Emmy Lazard, and we actually had mentors from the U of A debate club.
Oh, nice.
And they would come. I remember them very well. There's one guy called Quentin, and then there's another guy who was in the student journal here. He was one of the editors. I remember y'all. I don't remember your names exactly, but I can remember faces. And so they really mentored us. They're super nice. And so all throughout my high school journey, I volunteered. And even after high school, I kept volunteering. And then one of those volunteer roles, I ended up working at a local nonprofit called Action for Healthy Communities. It was a great experience, although I no longer work there anymore. But I think a lot of my experience there is how I came to really work a lot in community. And then after that, I originally wanted to go to law school. Mm-hmm. That's what I always wanted to do, because I was really interested in law, but not law per se, but helping people. I was like, I want to help people. But they're like, okay, go to social work. And I'm like, social work, I don't know if I can help people. I mean, you help people in social work, but in terms of like the legal and the structural barriers that people face, mm-hmm. I don't know if social workers are empowered to address some of those structural barriers that people face. So that's why I was kind of leaning away from social work, although social workers do help people. Let's not say they don't.
They do. Yeah. They do, and I appreciate my social workers.
Yeah.
Yeah, we do.
And so I didn't go into social work, but I did sociology, which is like the study of social work. Mm-hmm. So social work, when you study social work, you study the practice of social work. So a lot of our courses intersect, but in sociology, we don't study things like case management and stuff like that, which I wish we did a little bit. I wish there was more like talk between the social work and sociology fields, because they complement each other so well. Mm-hmm. And so after that, I graduated. I also My minor was originally double minor French and computer science. But then the thing is, computer science, it has to be your major. Because it's so time consuming.
Yeah.
So I switched in my second year to human resources.
Yeah.
Because I was like, this is taking up way too much time. I can't, but it's fun. Guys, if you have a chance, take a computer science course. It is fun. Or just like learn coding, learn a language, whether that's Python or anything. It like you can do it as a hobby, like just learn it. It is such a great skill to have. And it teaches you like things about like, you know, how does your phone run? How does your computer run? You don't have to like be the best at it, but just like learn a few things here and there, because it is really beneficial.
Yeah.
Bonjour tout le monde, je parle français un peu, mais je ne pratique pas beaucoup, so I don't practice a lot.
Oui, moi
French.
aussi.
Yeah.
Moi aussi.
So,
J'ai le même problème. Le problème même, je ne sais pas.
Yeah, but there is actually a strong French community. We should
practice together. I feel like we're at the same level.
We do. We should. I read French and write better than I speak, which is weird.
I can't understand what people say if they talk so fast, because they talk so fast. But I can speak okay and read okay. And write, I don't know.
So for the listening, I do sometimes, you have to keep listening to the podcast. What I will say, McEwen has a great French program, and that, I don't remember that professor's name. A lot of the professors teach both at McEwen and at U of A for French, but they have a great French program. And what they do, they have like oral examinations, but also they test you based on you. They don't test you based on the class. They test you based on how you're improving. So let's say you come in as a level 5 and someone else comes in as a level 3. They will assess you as a level 5 and how you've grown, and then they will assess them on a level 3 and how they've grown.
I see.
So it's like they'll try to like level it out, but they'll base it on your journey. So if you've improved, your improvement will be your success and your marks will reflect that.
Yeah.
But if someone on level 3 has improved, they're not going to like take your level of like learning to put it on them, because they also are at a different level than yours. But if you are French immersion, you need to disclose that, because they will put you in a higher level class. Anyway, I think I went off topic. That's ADHD. But back to why I entered the Masters of Community Engagement. After my work at Action for Healthy Communities and working with youth, I realized that I needed to have more skills and more ability to know what's happening like structurally, because I saw a lot of gaps with the youth that I was working with, and I always ask myself, okay, so why can they do this? Why are they having to do this? Because my role, I had to, and I think, Farah, that's how we met, right?
Yeah, that is how we met.
I'm not that old, guys. I'm also a youth working with youth.
We're not. Yeah, she's a youth working with youth.
Yeah, a youth working with youth. So I always felt weird saying that, okay, the youth are, and I'm like, but I'm a youth.
Yeah, that's true. But that is how we met. And I was also a youth working with youth, including Rayyah. Yeah. We had a very cool project on sustainability. And like Rayyah was actually like managing multiple projects, but my project was on sustainability, so that's how we met. Like a year ago, or even more. That's crazy. Yeah.
And through that, I realized that there's so many youth who have the passion to do projects and the ability to stay determined, but there are barriers that kind of stop them. So I was like, okay, I want to do law. So in my mind, I'm like, do I study one more year for the LSAT? Because I got a good mark in the LSAT, but my GPA was kind of like a little bit low. So I think I'm what you call a splitter. Because in law school, they evaluate your GPA and your LSAT score.
I see.
So my GPA like wasn't low, but it wasn't like competitive enough. So I'm like, I have to have a competitive LSAT score. So I took the test, and I think I got like 165 on the test.
That's good, actually.
That's
I
good.
think that's like the average of what gets accepted, or even.
That gets if you have a competitive GPA, right? Because these law schools are out here, they're saying, but I wanted to aim for higher because I think 180 is the highest mark you can get.
So you did well.
I did well, but like I'm too scared to I have rejection sensitivity, especially if it's something that I really care about. Yeah. So I was like, okay, I'm not going to study one more year. I want to do like a master's, and because I want to still learn something. Yeah. I really like community engagement, and so I said, okay, I reviewed the U of A website, and I saw they had this master's, and it was about if you've been working in community and everything. So I applied and I got accepted on a thesis, but I'm now course based, which is I think is still good because I'm still getting to be exposed to a lot of like research skills and all of that. Yeah. So that's kind of how I came into the Masters of Community Engagement. I'm also the representative for the program. It's a good program, I think, especially if you want to learn more how to engage community. I would recommend that you have some volunteer experience under your belt, or some experience working in community in any aspect, because otherwise you might not understand the foundations and use them. So volunteering, being in community really matters if you would be interested in taking that master's.
Yeah, absolutely. Actually, I wanted to say something about the rejection sensitivity thing, because that is something that I've had that for quite a bit. And then, you know what really helped? Just getting rejected so many times until it never hurt anymore. I became
resilient. That's the word. I hate that word, but that's what they use a lot.
I guess you can call it resilience, but you can also call it immunity. Building an immunity.
Immunity, yeah.
I guess you can call it resilience.
I like immunity better. Yeah, I like that.
So it doesn't hurt as much. I mean, I'm like, obviously once in a while, like if I get 20 in a row, like I'll be sad. But genuinely applying for things that I don't think I'm qualified for, and then
I think there's someone that says that that's what every white male does. Things that you're not even called. So as racialized women, I think, even just women in general, I think we should be more shameless. We should be more shameless.
Please don't take this out of context.
Please, if you take it out of context, I don't know what to tell you. I don't know.
Yeah. But I guess going back to your main point about community engagement, that is very cool. Like a very cool program. So what are your, what do they teach you in this program? How do you engage effectively with community? How does it?
So one of the things that, one concept that's there is it's called community engaged scholarship. Okay. So a lot of the times, because Canada is a multicultural society. We are multicultural, but we are sitting on Turtle Island as well, Indigenous land, reconciliation. So there's a lot of conversations that haven't yet been had. Yeah. So wait, my ADHD. The original question was,
how does this link to public
health? Yes.
To public health, and what do you guys learn?
So, a lot of communities that are on the margins, that are discriminated against, are distrustful of public health systems. They don't trust them because of, obviously, there have been generations of, the medical system, the public health system, not being 100% transparent. So in Canada, you can point to the repercussions of the Indian Act, what happened when Indigenous people were put into residential schools. You can even see how, let's say, newcomer communities, maybe they're not given all the information that they need, and maybe now they're distrustful of the public health system. You can even look at Indigenous, racialized, and even Black maternal health outcomes. Yeah. That's a marker of how there's distrust of the public health system. COVID-19, the vaccine thing, that was also a marker of like, you know, how the public doesn't trust the public health system, because as much as we want to say misinformation, that's also a mix of like, you know, trust issues with the public health system.
One way to say
they have
it.
Trust issues. But also, like, for example, Henrietta Lacks, you know, her cells were used, you know, without her permission in like America. And I say America because America and Canada are very, as much as we say elbows up and we don't want to be associated with America, a lot of American policies are kind of like a little bit applied in Canadian policies, just a little bit. They're taking it a little bit. And so Henrietta Lacks, her cell, she was like, I think it's in the 1930s or 40s or something. Her cells were actually the first to like mutate outside of her body or something. And now they are used, the Lacks cells, they're used in different lab trials to test on like cancer cells. So, but those cells were gotten without her permission, and her family, I think, just recently went on trial or something. Even the Tulsa experiment where they put like syphilis, they knowing some medical research experiment, they knowingly put like syphilis into like a Black community in Tulsa, and just to like see what would happen and experiment on them. So stories like that don't just remain in the US, they also permeate and like travel into the Canadian public health system, because we share a lot of public health infrastructure. So that's where these systems are built on, you know, these engagements. Yeah. So community engagement comes in to say, how are we as researchers, because research, like qualitative, quantitative, especially when you want to get research that's going to help the public, you need to have public buy-in. And so it's like, how are we as researchers engaging with the public? Why are they distrustful of us? How can we have more equitable research? How can we not just make communities like participants, or how can we also respect the knowledge that and the strengths that they already have, so that we are partners in their research, and we're not kind of like standing over them, looking down, because that hasn't worked so far, if COVID-19 has shown. So that's where the community engagement degree comes in. It comes in, and it kind of like, it's like training us to say, how can you engage with communities in ethical ways? So if you're engaging with Indigenous communities, you have OCUP principles. What are the ethics that you're following? But also, what does engaging in research that empowers and also gives community the tools to empower themselves look like? So that's that degree.
Okay, that's cool. One thing that my honors nursing program has like taught me, and also just going to conferences and my particular like research projects have taught me, is the idea of community participatory approach to research. And this is something that like I do with my project now, where we not only actually, a lot of the things you said are very similar. It's interesting that we are in very different programs, but we're doing very similar aspects of community engagement.
Well, you're in nursing, but nursing is also about a lot of care, right? Because it's a care industry. It intersects with care in the medical industry, and social work is more just so you're like at the intersection of the medical and care industry. In a way,
You know what? That's actually a really cool way of putting nursing as a mix of medical and social work. Because I am very passionate about social work. I think social workers deserve way more credit.
Also, non-registered social workers, because they are a lot of non-registered. You know, okay. In my undergrad, I did.
Wait, can I just finish what I was gonna say?
Okay,
sorry.
Yeah.
So I was gonna say, like the research project that we're working on right now is very similar to what you were talking about, because what we're doing is we're not just doing research. It's related to sexual health for parents and youth. Like, what do parents know about sexual health so that they can educate their youth about it?
I love that.
Because like recent studies have found that like the rigid structure of our sexual education in schools is just not very individualized, and it doesn't, especially like you said, in a multicultural society. It's like everyone has different values and everyone has diverse experiences and backgrounds, and so the sexual education system currently doesn't serve these populations because sexual education can look very differently to different people.
I agree with that, because when I was working with newcomers, with the youth, we would go into the high schools in Edmonton or even elementary, and sometimes we'd have lessons on like, maybe is it like what is, gender diversity, what is sexual health, how do you go around that? And even in those, sometimes some kids would be like, okay, my parents would like me to I'd have to get consent, or even the teachers would tell us, oh, maybe they might opt out or something. But this is not just in newcomer communities. Even with Alberta passing a lot of registration, even in Alberta, they opt out. But the question is, what happens when they opt out?
Yeah,
right?
What do these kids know? Yeah, exactly. That's actually
so I think your research is very important in like addressing that gap.
Yeah, so a lot of the work that we started doing was through participatory like community engagement, where we have workshops with these youth and these parents, and we ask them about like, what do you want to see? Like having focus group discussions and then asking them for feedback after. So it's not like a one-time thing where we're asking them for their input and then we're not and then we move on. We're asking them for constant like evaluation. Is this working? What do you think of this? How can we make this better? And it's a constant working with community that also is not only one way, and it's two ways, because we're providing them with tools and resources and answering their questions and providing them with monetary compensation, all these kind of things. So, that's just something that's very
And monetary
similar.
compensation is something that's huge, because I think one thing that is big in becoming an informed scholar, like community-based scholarship, is that you have to understand your position as a researcher, and then also try to understand the position of the people that you're asking to engage in your research, because you might not consider the fact that this person doesn't drive. They have like maybe 4 kids. They're taking, this is like a lot of time out of their day to come to you, and you're requesting that. But if you don't offer, like, if you're looking for like 20 participants who are like in the demographic of this person, maybe they're racialized or like and they're like identify as a woman, and you're looking, and they're low income, and you're looking for their input, you might not get, the reason why maybe you might not get the participants isn't because, oh, they're just not interested in like having their story heard. It's maybe you're not removing the barriers that they have to getting to you, and that's why you, out of 20, you only have like 5, and those 5 might be self-selected or like self-selecting, because those 5 are maybe people that maybe someone who knows someone who asked for. These are not really, they might not be representative of the population. So if you want representative like samples, you need to remove those barriers. So like offering rides, whether that's like an Uber, like back to where you want and there, or maybe you can go closer to where they live. And so you have to put in the groundwork. Community work can't be lazy. You have to put in the work, and I would say you have to come out of the ivory tower. And that's what they call it. It's the ivory tower. It's like there's nothing wrong with being in an ivory tower, but you have to know that the ivory tower is also, it's like a castle. It's like a wall, right? You if you want people to, either you make it easy for them to come in, or you have to like go to them. Yeah.
Totally. Yeah. Um, yeah. Totally.
Yeah.
I was gonna. So I cut you off earlier, and I apologize for that.
No, it's
now
okay.
I forgot what you were gonna say. Were you gonna say something about your undergrad?
My undergrad.
Or was I?
I think
remembering things.
I think it's okay.
Okay.
Yeah.
It's fine. I just want to make sure.
Hopefully, if people can tell us in the comments if
What
we
they wanna
missed it.
hear.
Yeah.
So what is your vision for what a healthcare system or what a health system looks like that is empowering to youth and that is empowering to racialized youth? What does that look like to you?
Actually, in my undergrad, I had the chance of working with a few researchers. One was Dr. She worked in McEwen, but she's also here, works at U of A. She's a nursing professor.
Margot Jackson?
Yeah, Dr. Margot Jackson.
Yes,
Yeah.
she taught me my public health. No, she taught me my mental health rotation. Yeah. That was a really cool class. I love her research. Oh my God. Okay, continue.
So I worked under her and another researcher,
So
Dr.
cool.
Ginny Menon. She was from McEwen, but now she's at Concordia University.
Okay.
In Edmonton. And then I also worked with Dr. Vinny. She's at the University of British Columbia. And so their research is on mental health, like you were saying. And so I was put on as a student research assistant.
Yeah.
The way I got to hear about that opportunity was at McEwen. I was president of the Black Students Alliance, and they approached the Office of Research Opportunities, approached us, and they're like, hey, we have some opportunities for Black students. Would you be interested? So we shared it with all the group, and I was also able to get that opportunity to work with them as a research assistant. So their research was on like mental health wait times, and they also had some research. Their research was very central community-based participatory action research, very much qualitative research, and that's also so my work with Action for Healthy Communities and also my work with them is what inspired me to go into the master's.
Yeah.
And so as a result of that, I was able to publish a literature review in the Canadian Journal of Undergraduate Studies. So if you look, the publication should be out right now. And the reason why I bring it up is because that publication was on youth mental health wait times in Canada.
Yeah.
And
so is it like how long youth wait to get mental health counseling? Like, is that what do you mean?
So yes, but it was a review of what surrounds everything. So emergency room visits are a huge thing where like people their mental health will be really bad, and then they'll go to the emergency room instead of like preventative care.
That's a huge thing. Okay, wait, I'll talk about this after.
And then another thing was public versus private healthcare system. So because a lot of people wait a long time, then it's like, should we go to the private health route? So some families can afford it, some can't, and some are in debt because of that. Another thing is gendered youth. Some youth who are gender diverse, maybe they don't feel comfortable going to like their family doctor or another doctor for fear of being like judged, so they'll like delay getting their health care. Even racialized youth sometimes will be racialized, Indigenous, and Black will most times use the ED as their first point of contact. So all of those kind of show me there's a need for preventative and also integrative, preventative and integrative healthcare. So I would like the healthcare system is not bad, right?
Yeah, it's definitely it's not bad.
It's not bad.
It's I actually do think sometimes you forget to mention that it's not bad.
It's not bad.
Like going up in different countries, like or I don't know, like what like what age
Uganda,
you came
yeah.
here,
I came in when I was 12, yeah.
Yeah, I came here when I was 12 too.
Oh, yay.
So a lot of, like, we lived in countries that, I personally can talk for my country that had a way worse healthcare system. So, and that's like for a lot of reasons, okay? So I do think the Canadian healthcare system is great.
Yeah.
Like, all things considered, it is great. And I think there's always room for improvement, but I think it is great.
I think it is great and even awesome if you are health literate.
Absolutely.
If you are health literate, you know how to access 811, which is you can access a nurse. If you have something that's not an emergency, you can access a nurse. A lot of people don't know that. If you are able to go to a pharmacist, you can get a prescription that's not like, you can get prescribed some prescriptions from your local pharmacy with a Shoppers Drug Mart Rexall. You can even, you can go to any walk-in clinic and like, you can do that, like go to a walk-in clinic and get, some of your healthcare, and you can even get online. They're online health clinics, guys.
Yeah.
That's how I started getting my ADHD meds. When I was on the wait time to see a psychologist to be diagnosed with ADHD. I went to an online Canadian clinic and they were like, yeah, you have ADHD, and I got my meds, right? And it was free.
The wait time?
There was no wait time.
Oh wow.
It was no wait time.
Okay.
They diagnosed me.
Sorry, go ahead.
They diagnosed me, but you can get diagnosed and ask. You'd have to pay. This is where the payment comes on. But it's like 150 around there, and then you have to pay something like maybe $50 to get them to send it to your family doctor, who is the one who like verifies that assessment.
Okay, so it's a bit more expensive than it would have been.
It's more expensive than it would have been, but the thing is,
wait time.
I needed that, right? Because that's what I was studying for the LSAT, and I could not
focus.
LSAT, you write it for 3 hours. It's a 3-hour exam.
And you read a lot. Yeah, I bet.
And you can't it's very anxiety inducing, and because of that, I kind of coasted through my university, my undergrad.
Yeah.
Undiagnosed ADHD. I don't know how, because my sister has ADHD. So I was undiagnosed for all that time until I encountered a challenge that was like, you have to go. Yeah, LSAT was the challenge. I was like, you have to go and I was like, there's something wrong. This is not normal. This is not normal. Because I was used to maybe 30-minute 1-hour exams.
Yeah.
So it's like, this is not normal. So I went and I got diagnosed, and
Yeah.
But integration is very much needed because I am a settler to Canada, but as someone who is grateful for the opportunities that I have gotten in Canada and in Edmonton, Alberta specifically, I would want our healthcare system to be strengthened. I do not want it to be dismantled. I don't want it to become like private healthcare, public healthcare. I know why the people who are advocating for private, well, there's two types of people. There's the people who just want the money, which is okay, but you should go to America if you want the money. And then there's the people who, you can't wait, right? There's sometimes we're still life and death situation.
Yeah.
And we've had that story here, that guy who died.
Yeah.
Right?
And sorry, you just talk about so many things I'm passionate about, so I have to interrupt.
Yeah.
I work as an undergrad nurse now actually I shouldn't say where, but I work somewhere. I work at a hospital.
You work somewhere, yeah.
And people, I've seen people die waiting for procedures. I have seen a person die waiting for, I can't say what kind of procedure because then...
Okay, we're not legally liable for anything. This is for educative purposes.
Yeah.
I do not use this as anything, but
I definitely seen someone die from not getting a procedure because they just couldn't, they were on the wait list. People die waiting, and I've seen it. It was so hard because I knew this person.
That. So
okay,
I can't.
People this is reality. People die waiting for a procedure.
So the question is, are you going to keep waiting, or if you're the family member, you would opt for the private.
Totally.
But so I understand those concerns.
I understand both. Yeah, I definitely understand both perspectives, but I see what you're saying.
So I would say we shouldn't demonize the people that they they need healthcare, and the only if they can, they're going to pay for it. We shouldn't demonize them. The people who you just want extra money, maybe we might demonize you a little bit, because you're taking advantage of the other people who they have no other option and they really need that. But it shouldn't be. It should be a bipartisan thing. It shouldn't be, we should like dismantle the public health. No, it should be, how can we make it better so that people aren't waiting like this long and they're not like passing away, because that should be the conversation. Because people going to private healthcare is like a symptom of the issue. It's not like the solution. It's just a symptom, because we can look at America. They have private healthcare, and what happened to that CEO who got shot? That's where we'd be going if we went into the public healthcare system. I'm not saying anyone is going to shoot anyone. I'm not legally liable for anything here. I'm just saying that
this is getting dark.
I'm just saying that people in America, I watched the documentary where like if they have a fracture, instead of going to the doctor, they'll like try to fix it themselves, and they'd rather be in pain than like go into debt going to the hospital. So
I understand. I can see the cons of having a private system in where people would rather be impoverished than seek the care that they need.
It's a slippery slope, because once you go down there, there's no turning back. It's like opening Pandora's box. It's like,
I can see that. It's definitely hard. I don't know what to say.
No, I don't know. There is not a lot to say. It's just.
But you said, you used the word integrated, like an integrative health system. What does that mean to you?
Integrative is it's a harmonization of service delivery. Okay. So
prevention is linked to treatment, is linked to like tertiary, secondary treatment.
Yes. So So the first question you asked was like what I would envision the healthcare system to be. So very much harmonized service delivery. So I would say that in some parts, or even some parts like even in Alberta or even Edmonton or Calgary, there are parts of the city or some clinics that have that, or some regions that have that. But the issue is that it's not generalized over or like. So you'll have some really great clinics that have that, and then you'll go to another clinic and it's like different. So that disparity is what kind of becomes a bottleneck for the healthcare system. So in terms of community engagement, would you want to say how community engagement comes in as preventative in that sense?
Yeah, actually, let's talk about that.
Yeah. So community engagement, I'm doing the Masters of Community Engagement, but I think all departments to an extent work in community engagement. So in business they call it communications, PR, public relations.
Same concept.
It's a similar concept. Yep. Media, social media engagement. Nursing would be bedside care. Community engagement would say it's like all of that, but then how it comes, it brings in the community, right, immediately whenever we're developing the research. But we also develop the research. The goal is to develop the research with the community, not for them, but with them.
Yeah.
And also give them a way for them to be co-researchers. So they're also the researchers on that journey, because they know their community best. They know like kind of what's needed as a researcher, and as the person who has that that technical knowledge. You're coming in to offer something, but they also have gifts and strengths that they have that they will offer back. And so when you're doing community engagement, what you're trying to do is you're trying to organize these gifts and try to identify the root cause or together, rather than looking at it through like a one-way lens. So I think there's different ways to do like community engagement. It just depends on kind of the person, what your interest is. There's like mixed research methods, qualitative and quantitative. There's narrative analysis. Photo voice is very popular with a few people. I think it's called ethnographic research is also popular. Case studies are another one, but it's just how do you do the study design, is where it also comes in. Are you putting in community consultation, voice, engaging the community, like collecting data effectively? If you're working with newcomer populations or even indigenous populations, do you have an indigenous core researcher somewhere there who can help you in understanding the cultural context? Do you have someone who can interpret like the language so you don't get lost in translation? So you don't think something is something, but it's not, because as a researcher, there is a power imbalance, so maybe they might not be comfortable telling you something. So you go into all of that. How do you design your research in the way that you get the best possible like answer? But another part of that, I would say, is because a lot of the communities that are distrustful are usually marginalized communities. So any researcher, that is not from one of those communities, whether you're from their community or whether you would try to do a lot of self anti-racist work, is self-education, self-reflection. Also learn about the community that you're going into. So for example, if I wanted to work with like a Cree community group, I would probably do some background research that I'm not putting the burden of education on that community on them.
Yeah, absolutely.
And then also having someone who is paid, who can, buffer that cultural context, but also not coming as a position, oh, I know everything. Say, I'm here to learn, and also kind of support in your journey to like solving this community issue. That approach can really actually change the results of the research that you get. Yeah,
absolutely. Yeah. Last episode, or like last at recording, we had an Indigenous student come and talk about like engaging meaningfully with Indigenous groups in research, and like a lot of the things you're saying, but also it's not only limited to Indigenous populations. It's also like racialized communities and different gender communities. All of these things that still we need to kind of educate and reflect on our own values. And
it's a journey. If you're not from the community, or if you are, but you maybe haven't been there so long or something. So it's a journey that is not easy to walk, but it's one that is necessary to become a better researcher.
And like building relationships.
Building relationships,
which can be hard, because as you said, people are distrusting of research systems, and especially again looking at the history of like what you were talking about, like research experiments that were meant to harm certain communities, and like how do we reconcile, is that the right word here, and rebuild a relationship that is more healthier.
Because even thinking about my own like community back home, because one of for the MACE degree, if you're a thesis, you do a thesis project, and then if you're like course based, you do like a capstone. Thinking about my capstone, I've been thinking about doing a project with an organization back home in Uganda, but even then, these questions of like community engaged scholarship are coming into my mind because I don't want to come in and be kind of like, oh my God, I am coming in to save you. Oh my God, I'm here to save you. I don't want to
The savior mentality.
the savior mentality. So that scholarship of, okay, they know what needs they have. They know what kind of solutions that they would like to see. How can I support that? And how can I also empower them to be core researchers and not like kind of just
Assistance.
like tell them what to do kind of thing.
Like empower, and empower. I don't know if the use of the word empower is. I don't like to use that word a lot.
Yeah.
Like I feel like I can't find a better alternative. But the word empower other people is like to give them power, and I feel like that in itself is wrong. But you said it. You used a really good phrase earlier. You said give them the tools to empower themselves earlier.
Yeah.
And I feel like that's
like walk with them on their journey, on that journey, and just be like that support, but also like be open-minded because you might also learn things along the way. Yeah,
absolutely. This episode is running a bit too long, so why don't we cut it here and then we'll start another one, so you guys can stay tuned for our upcoming episode with Rayyah. Yeah.
Thanks everyone.
Okay, bye.